Welcome back. This is Dr. Noah, your host for 21st Century Natural Health, and as I do every week and also on my TV show, I review the scientific literature about the heartbreaking type of news in terms of helping you get well. We'll first talk a little bit about the swine flu update. As of yesterday when I did the review, the CDC is looking at in terms of longer term outlook in terms of what's happening with this flu. There's 2,600 cases. What's interesting about this particular flu is that usually it attacks very young and very old. The median age is about 15. During the whole world, as of Monday, the death rate was 53 of confirmed swine flu. They have to understand that flu occurs every year. There's all kinds of flus, which are up to 200 or 300 different strains that come around the world. And this particular swine flu has a particular type of genetic code, and it has to be done by testing, not by just because you have this flu-like type symptoms. In the United States, as of Monday, there was 3 deaths. That's 0.14 deaths that has happened over the last 3 plus weeks since the swine flu outbreak occurred. Now, to put this in perspective, is that adverse prescription drugs kill 1,153 people per day at a cost of over $200 billion. Medical errors cost about 268 deaths per day. Now, once again, the deaths in the United States are down to 0.14, not less than 1/10 of one death. Every death is very, very sad and very tragic. Bed sores in hospitals kills 315 deaths a day and costing $55 billion in extra costs. Infections that you get at your drug doctor in the hospital, that's 241 deaths per day. Not per year, per day. Once again, swine flu has killed 3 deaths in 3 weeks or plus. Unnecessary medical procedures, 101 deaths per day at a cost of $122 billion. And surgery, every time you have surgery, there's a risk 88 deaths per day, $9 billion. So that's a total, in terms of the last 3 weeks, once again, 3 deaths with swine flu, medical errors and all the above, 45,444 deaths at a cost of $393 billion, which we'll talk a little bit about. That's the new trying to cut back on the sick care system in the United States of saving about $200 billion a year. That's almost $400 billion right there. And that's the General Electric is going to spend $6 billion in trying to improve the sick care system. And they want to try to do that by doing helping with unnecessary medical accidents, medical errors, poor medical care, which is the 3rd leading cause of death, as depicted in their particular article, costing $500 million to just General Electric, one company, per year because of the drug industry. Job loss makes you sick, and you're stressed out. As we've talked about on this and also on my TV show, stress is a killer. 60 to 70% of all diseases, heart attacks, strokes, cancer, osteoporosis, is related to stress. And this particular type of scientific article on Dermography, May 2009, showing that when you start to lose your job or about the possibility of losing your job, that can increase your chances of hypertension, heart disease, heart attacks, and diabetes. Narcolepsy is an autoimmune disorder. This is a Natural Genetics, May 2009. This is a Stanford University study showing that the sleep disorder, where people just fall asleep, is once again a specific type of altered type of immune system, where your own immune system, instead of killing bugs and foreign substances, it starts killing different things, and this happens to start killing different brain centers. Camphor, pest control, causes seizures in children. Not only in pest control, a lot of different topical applications for aches and pains and stuff have camphor. Be very careful. This Pediatrics May 2009 study from Albert Einstein Medical College said that seizures can occur. So there's lots of other better type of topical counter irritants out there than that. Obesity and allergies, we've talked about, 60 to 70% are overweight and obese, cancer, heart attack, strokes, diabetes, you name it. Now in this Journal of Allergy and Clinical Immunology, May 2009, showing an increase of 26% if you're obese, having allergy because you're increasing these different inflammatory compounds called immunoglobulin E compounds, and that causes your factor. Here's another cancer obesity link, Michigan University, colon cancer, 50,000 deaths per year, and that was shown to be very, very high. Another study showed 52% of all cancers can be linked to obesity. Amino acid supplementation helps preserve muscle function. When elderly people aren't able to move because they've hurt themselves, by giving them amino acid supplementation, they're able to preserve the muscle function in the elderly during compulsory inactivity. That's the quotation. That's in Clinical Nutrition, May 2009. They were taking about 15 grams 3 times a day for 10 days, and this was a University of Arkansas study. Folate and wheezing. This has to do with B vitamin, folic, and folic acid. In terms of helping with wheezing problems, Johns Hopkins medical study showing that this is able to reduce the amount of immunoglobulin E, again, inflammatory compounds due to allergies, by 70%, and that can be found in the Journal of Allergy and Clinical Immunology, April 2009. Vitamin K, vitamin K1 and K2 improve bones and reduce fractures. University of Tokyo review 7 randomized control studies showed that the vitamin K1 and 2 improve bone and reduces bone fractures, and most good nutrients will have K1 and K2. When I look at that. Zinc supplementation improves survival with advanced nasopharyngeal cancer. Taiwan study, randomized control studies, taking people in their stage 3, stage 4, very serious type of cancer. 75 milligrams per day of zinc for 2 months, and it showed significantly reduced the tumor reoccurrence and increased overall 5-year survival. Laryngology, April 2009. Very exciting research there. That's showing that natural nutrients have a very, very powerful impact. Here's another one. B6 protects against colorectal cancer. Harvard study, inversely associated. So the more B6 you had, the less you had the chances of colorectal cancer. And that can be seen in cancer epidemiology, biomarker prevention. That's May 2009. Curcumin, one of my favorite herbs, turmeric, exhibits antimicrobial activities against H. pylori. That's a bacteria that causes lots of type of upper GI problems, a little bacteria causing gastritis, peptic ulcer, gastric cancer. This study was done in India and showed excellent antimicrobial activity. And you and your doctor can read this at Antimicrobial Agents Chemotherapy, May 2009. Antioxidants, I talk a lot about that. In my practice, I test that using advanced technology, laser technology, in fact, from the University of Utah, to measure antioxidants. Here's a study that was done in Poland, published in Clinical Biochemistry, May 2009, that antioxidants and hypertension have an increased relationship. So increased oxidative stress explains some of the factors of hypertension, so you need to look at that. Isoflavones are a viable alternative to estrogen therapy. We've talked about the hormone replacement therapy killing up to and possibly more than 6 million women. And that study was stopped in 2002, but it's coming back. This Johns Hopkins medical study, randomized control study, showing that 20 grams of soy protein or 160 milligrams of total isoflavones for 12 weeks improved all the different type of estrogen complaints that women have, improved vasomotor, hot flashes, psychosexual, sexual, physical, and there was no benefits with placebo. So very, very exciting. You can have your drug doctor look at that at Journal Endocrinology and Investigation, May 2009. That stuff works. Prenatal supplementation reduces risk of obstetric complications. Very, very powerful medicine. Here is just a basic, good multiple vitamin randomized control. Was able to reduce postpartum hemorrhaging by 59% and premature rupture of the membrane by 40% by just taking a good prenatal supplementation. And selenium and linked to skin cancer, Australia, basal cell and squamous cell carcinoma had a direct benefit in terms of a good intake of selenium, but there was no links with vitamin E and carotenoids. So you can also look at that at the May 2009 Cancer Epidemiology Biomarkers Prevention, and I'll see you next week. Keep happy, healthy, and prosperous. Thanks.